Sallu ala al-Habib sallallahu ta'ala ala Muhammad sallallahu ta'ala alayhi wa alihi wasallam. Dear viewers of social media, welcome back to our Leicester Fazane Medina Facebook page. We are back again with our segment or our program, Health is Wealth. And Alhamdulillah, we are live with our GP from Leicester, Dr. Adin Hussain. Assalamu alaikum wa rahmatullahi wa barakatuhu.
Wa alaikum salam wa rahmatullahi wa barakatuh.
Adin bhai, thank you very much for coming and blessing us with your precious time. Before we actually go to Dr. Adin, just a brief introduction of Leicester Fazane Medina. Alhamdulillah Azza wa Jal, this is one of the amazing buildings of Dawat Islami here in Leicester. Quite a large building with 42,000 square feet internal area. And Alhamdulillah Azza wa Jal, Dawat Islami purchased this building back in 2015. And since then, we have been obviously running quite a few services, including Masjid, Madrasa. Also, we have Madrasatul Medina for boys and girls. There are many residential courses that are taking place for Islamic sisters, other educational services for Islamic brothers. We are developing funeral services in our building, which is in the pipeline, almost near to the finish. And also we are trying to open up an Islamic nursery for worldly education, and hoping to establish a primary school here in Leicester as well, in our Fazane Medina building. Now you can watch our Fazane Medina live Facebook streams on our Fazane Medina Leicester Facebook page. Our obviously broadcasts also go on YouTube, so you can actually watch them as well there as well. Please do share these with others. Clearly, there are a number of different things that you will benefit from this, especially medical topics, including also religious programs too. So let's go to Dr. Adin. Today our topic is heartburn, which clearly is a common problem, and I myself experienced it a couple of years ago during the month of Ramadan. And clearly in the month of Ramadan, the heartburns do go up. We end up burping, and we witness it in the masajid as well. So Dr. Adin, first of all, just give us a brief introduction about what is heartburn, and what is normal and what is not normal.
Bismillah ar-Rahman ar-Rahim. Rabbi shrah li sadri wa yassir li amri wahlul 'uqdatan min lisani yafqahu qawli. Assalamu alaikum, everybody. So we'll go through this hopefully in a sort of structured way if we can. Some of you may also already be experiencing heartburn or be on treatment for it. There are certain sort of special situations of treatment, but we'll just try and keep it as general as possible so it caters for the vast majority of people. Now, as our esteemed host also suffered with this problem before, it's very common actually. About 12 to 40% of the population will suffer with heartburn at some point in their lives. And they say about 40% of adults will get it at least once in a year. Both men and women are affected by this. Sometimes men can have the more serious forms or severe features of heartburn, but generally speaking, they're both sort of equally affected. And then the other thing we have to look at is how we go about managing this. So one of the things that we do is we usually manage it based on symptoms, but some people may go on to have specialist tests, whether that's a breath test, a stool test, or even have a camera down. So we won't be touching on these too much, but it just in highlight that, you know, if anyone has had any of these, is also part of the treatment. Now, heartburn is a general term. In the medical field, we call it dyspepsia. And I think what the main focus of today will be the common one that we all experience, which is the burning, basically the problem that you get in the middle of the chest near the heart, and then it usually works its way up your food pipe towards your mouth, and this is known as gastroesophageal reflux disease, or GORD, GORD. You know, there's various different ways of writing it, and as mentioned, many of the listeners may already be experiencing this problem. Now, if we look at why this occurs, so the normal physiology is you eat some food goes down from the mouth, you know, down your food pipe via something called peristalsis, where one just squeezes over the other and it pushes all the food all the way down, and then it passes something known as the anti-reflux barrier. Now, in our term, we call this the esophageal gastric junction. Now, basically, that is like a band, and it lies just below your stomach. Well, towards where you think your stomach is, but actually it's below your rib cage. And we have something called the diaphragm there, and it sits just below that. Um, Now, one of the things that happens is when food goes down, it's normally then kept within the stomach because it can't pass this barrier up above. And on the picture, I think Dr. Zirak is already highlighting that area. You can see there's a band there, and that's the diaphragmatic crura. So this is another band that you've got within the diaphragm, which is the muscle of the breathing. And also within the muscle of the food pipe, there's a sphincter, which is it's just a round muscle, and it keeps it tight. Now, sometimes, this area can become weaker, and also the stomach, rather than the being below the diaphragm, it's actually a bit higher up, and we call that a hiatus hernia. Now, the stomach acid, generally speaking, should stay within the stomach, and then the acids start to digest the food, and then it passes through another area, which is the pyloric sphincter. You can't see it, but it's just where it says duodenum. The things will exit the stomach and go into your small bowel and be absorbed. So when you get the problem with heartburn, essentially what happens is that this acid that normally should have stayed in the stomach has gone in areas where it shouldn't have gone. So it goes up the esophagus, which is your food pipe, and then it causes burning of the food pipe. But sometimes you can go a little bit further and get passed through your small bowel and gets pain across the tummy. So people can get varied symptoms with this. If we look at what sort of types of indigestion and heartburn there are, so the one we're talking about is Giardi, which is the one problem in the middle, and then it works its way up. But also you can get issues just where there's too much acid and it stays within the stomach, and the stomach can't really contain all of it, and it starts to digest or cause problems in the stomach, and you can then go on to have ulcers or esophagitis and things of that kind. The other things that we have to realize is that by all means, we always say, we like to know the reason behind why people get indigestion or heartburn. But the problem is that sometimes we just don't find a reason. We call that functional. So they're difficult to treat with these people because we never realize what happens. But in general, in terms, hopefully the advice that I give later on may help benefit everybody anyway. I can go on to talk about symptoms, but I don't know if Zirak wanted to do a recap for those who are non-English speaking.
So clearly, Alhamdulillah, you have आपने माशाल्लाह बड़े एक रफ्तार के साथ जो है वो बयान किया इस हवाले से. तो बेसिकली जो अगर मैं इसको समरी करूं, हो सकता है बाज अक्सर जो है ना जो बड़ी उम्र के लोग होते हैं उनको भी ये प्रॉब्लम होती है कि अल्लाह ताला ने एक निज़ाम बनाया है हमारे मैदे के अंदर कि जब हम खाना खाते हैं तो कुदरती तौर पर खाना जो है वो नाली से मैदे में जाता है. अब ये मैदे के अंदर काफ़ी देर खाना रहता है डाइजेशन के लिए, तो बेसिकली मैदे के जब इधर से जाता है तो यहाँ पे भी एक वाल्व होता है, स्फिंक्टर होता है जो कि टाइट होता है ताकि खाना इधर से भी बाहर ना निकले. तो बाज़ दफ़ा क्या होता है कि ये स्फिंक्टर जो है ये लूज़ हो जाता है या वो ऊपर चढ़ जाता है जिसको हाइएटस हर्निया भी कहते हैं. तो उस वजह से जो है ना फिर क्या होता है कि जो मैदे में खाना वगैरह या एसिड बिलखुसूस जो होता है वो फिर ऊपर की तरफ आना शुरू होता है, जिससे जो है वो हमें जो है वो हार्टबर्न फील होती है या खट्टे डकार आते हैं. अच्छा, बाज़ दफ़ा क्या होता है कि इसी तरह डॉक्टर आदिल ने कहा कि जो मैदे की दूसरी तरफ जो छोटी आंत में फिर जब खाना जाता है तो वहाँ पे भी एक स्फिंक्टर होता है. अगर वो भी लूज़ यानी वो प्रॉपर काम ना करे तो बाज़ दफ़ा मैदे के स्टमक एसिड वगैरह उधर ड्यूटीनम में चले जाते हैं. उसकी वजह से फिर आपको मज़ीद अलहदा तरह के सिम्पटम्स भी जो है वो आते हैं. अच्छा, इसका हमारे आसिफ भाई सवाल भी पूछ रहे हैं. आई वुड लाइक टू पुट दैट क्वेश्चन टू डॉक्टर आदिन एज वेल, दैट what is the difference between heartburn or stomach ulcer?
Okay, so heartburn is the generalized term of when the lining of the stomach or the other bits that we mentioned, which is esophagus, have been affected by the stomach acid. So that acid, like with everything else, it will have a burning effect because it erodes the skin. Now, if you're having it for a long period of time, because your stomach still has a protective coating, but sometimes that coating is then eaten away as well over time. Now, if you get past that coating, then you're eroding the lining of your stomach, and this is what causes the ulcer. So many of us will see an ulcer in our mouth when we injure it by, so foods that we've eaten or sometimes we've bitten our lip. You break that barrier, and then an ulcer forms. So the same way with the stomach, when you have too much acid, you break that barrier, and then as a result, the ulcer will form. Okay, the treatment in a way is similar in both situations, although ulcers take longer to heal. So actually the treatment is for a longer period and usually at higher doses.
Okay, so I hope कि ये क्वेश्चन क्लियर हो गया होगा कि बेसिकली जो हार्ट बर्न है ये एक अलामत है, अल्सर उसकी एक वजह हो सकती है, और अल्सर तब होती है कि जो मैदे में एक प्रोटेक्टिव लाइनिंग होती है कि जो एक्चुअल मैदे में होता है तेजाब, एसिड, अगर वो एसिड अगर हमारे हाथ पर भी रखा जाए ना तो नुकसान हो जाएगा, स्किन बर्न हो जाएगी। लेकिन अल्लाह ताला ने मैदे के अंदर एक प्रोटेक्टिव लेयर बनाई है, तो जब वो प्रोटेक्टिव लेयर जो है वो एसिड की वजह से जो है वो उसमें ब्रेक हो जाती है, या एसिड उसको जो है वो ब्रेक करता है, तो वो मैदे के अंदर जो है वो एक जख्म हो जाता है, और इसको जो है वो अल्सर कहते हैं। अच्छा, आगे चलते हैं डॉक्टर आदिल, सिम्टम्स के हवाले से कि what symptoms does one experience when they are having heartburn for whatever reason or cause
Okay.
they do.
Okay, I think there's a picture or something. It's not
Well,
come up on my screen,
let's
but
see if I can sort of
it's
get it
okay.
up
So
there.
I'll go through them anyway. So the
जी,
main thing that happens is naturally people experience the burning symptoms. So this is the burning that they get behind the we call it retrosternal, or in the stomach and behind the chest. And then essentially what happens is your body has to then try and manage that. Now sometimes it can manage it by increasing the amount of saliva that you produce. So saliva is alkali. And so you might notice that a lot of people get very watery mouth, and then they have to swallow a lot. And what the body is trying to do is buffer the acid. So you mix acid with something alkali, and you can neutralize that area. We call it a water brush, but that's one of the ways that your body will try and alleviate it. The other thing that can happen is the problem can cause people to feel a little bit sick. Because it's not a nice feeling to have there, and in most people who have had said will feel like they want to be sick. And some cases actually they are sick because the situation is so bad that actually when they've got the nausea, which is the feeling of sickness, they do vomit with it, or occasionally the acid that comes through will come through so much that it'll actually bring a lot of the stomach content with it, and that will be as a result of vomiting. Now, I think you mentioned in the earlier bit, which is about what happens when you're having things in during Ramadan, especially fatty foods. We may have all seen it where you're sitting in Taraweeh and someone is burping all the time. Now that's to do with an excessive acid production, but also it's a form of reflux. So these are the milder forms. Now those people probably aren't getting pains in the tummy, but they're still having the relaxing of that band that we said, the sphincter, and things are escaping from the stomach into the esophagus or the food pipe, and as a result, they're getting this burping or belching. One thing to bear in mind is that the more times that happens, the more gut content is being exposed to your mouth, and that can result in you get the halitosis or a bad mouth, or bad breath. Sorry. And then the other issues that you get is bloating of your tummy. So you get like a tummy that tends to distend out. Unfortunately, this then leads on to more belching. One of the things that's is quite useful to also realize is that we have two of these bands. So one is at the bottom between the stomach and the food pipe, and the other one is at the very top between your food pipe and actually the we'll call it the windpipe, but it's the bit where you can speak from, and the air travels up and down. So when you get acid that goes into this area, then you can start to affect the vocal cords, and you can get hoarseness of your voice. So it sounds very husky. You can also start to cough a lot because you're trying to remove the acid that's gone down the wrong way, because most people will have drank something, accidentally goes down the windpipe, and then they keep coughing. A similar thing will happen, but obviously acid is a little bit more dangerous in that regard. The other thing to bear in mind is that a lot of this can be linked to other problems. So like when we're having this in the background very silently and not even causing symptoms, people will start to cough, especially at night. So when they lie down, they seem to cough a little bit more. They might be producing a bit more mucus in other areas, for example, the nose, and then start to get dripping off on the nose side of things. In most cases, the symptoms are short-lived, so they last maybe a few minutes, up to 20 to 30 minutes, and then they will disappear. If you get up, for example, you help, hopefully gravity will aid the things staying further down, but obviously that's another issue altogether.
ओके,
wasn't
ये
sure. Yeah.
डॉक्टर आदिल ने जो है वो सिम्टम्स के हवाले से बात की, काफ़ी इन्होंने जो है वो सिम्टम्स अलामात हमें बताई कि मैदे में जलन होती है, तेज़ाबियत होती है, खट्टे डकार आते हैं। इसी तरह जो है वो बाज़ दफ़ा आवाज़ का भी जो है वो मसला हो सकता है, और फिर बाज़ दफ़ा ये भी होता है कि जब आप रात को सोते हैं तो खाँसी जो है ये भी इसकी अलामत हो सकती है। थोड़ी देर के लिए खाँसी होती है तो वो इस बात की अलामत हो सकती है कि जो है वो आपको हो सकता है कि हार्ट बर्न की वजह से हो रही हो, क्योंकि एसिड जो है वो आपके क्या कहते हैं कि ऊपर मुंह की तरफ आ रहा है। अच्छा, ये तो माशाल्लाह हमारी अभी डिस्कशन जारी है और वी आर covering different aspects of heartburn. The next question that I have is that what are the triggers that obviously lead to symptoms of heartburn? Clearly,
Okay.
there may be certain within our body, certain maybe sort of like external factors. So, what
Yeah.
factors actually cause heartburn or worsening of the symptoms from within our body and from sort of like external environment and the food?
Okay, so what we need to look at is, because the problem can arise in different areas of the GI tract, so anywhere between this so food pipe as well as the stomach and then the sphincter that connects the two. So we have to look at we'll start from the top. Now, one of the things that can cause this is that the sphincter, which is the band, stays a little bit weaker for some reason. Now, there are a lot of medical reasons why that can happen. So we won't go into in much detail, but actually the tone, in a sense, what happens is the tone. So rather than being very tight like this, it sort of remains a little bit open. It can't close fully. So there's a sort of and a passage that acid can sort of bubble up that way. We also mentioned about the hiatus hernia. So this is where instead of being below the diaphragm, your stomach is slightly higher and it goes through that gap. So the defect is so large that it actually passes through, and the stomach is basically more in your chest, so that you don't have that protective measure of something else wrapping around the head of the stomach, the top of the stomach, which then can stop the acid going up. Now, the other thing is that you don't produce also enough saliva. So sometimes, in order for you to buffer some level of the acid, is, as we mentioned, that your saliva will be produced and that will be attached to the food. And not only does it help it go down, but also it helps to then buffer some of that acid when it's down there. If you have problems with the ability of the food to get down, and as a result of lack of saliva or even the motility, which is the motion of movement, then it can cause a disruption in the sort of body's mechanism, and body can think, well, what's it going to do, and it might actually open the sphincter incorrectly. Now, the other thing that we have to look at is just generally, I mean, it can happen in normal situations as well, where in the stomach and the pressure in the tummy, for example, when people are pregnant. So when you're pregnant, you've got alhamdulillah, you have a baby that's been developing inside your womb, but obviously that womb is within your abdomen area. And as that baby gets bigger, it starts to cause less and less space for the stomach and everything else. And that's why women who have this problem usually suffer with indigestion quite a lot. You just have to have someone sit on your tummy, and try to, after you've had something to eat, and you realize that, it's really difficult to stay lying down without, having to get up. Now, one of the things that we'll talk about later, and it's quite important, and these sort of external factors, is also the foods that we eat. Fatty foods, especially, can delay the emptying of your stomach content. So as a result, you have more acid being produced continuously to try and digest this food. And the more of that you have, the more likely it is that you're going to run into problems, because we realize that the acid, either excessive amounts of acid or the escaping of that acid, is what can lead to the problems that we'll see later. Now, main things that we need to look at is also our weight. So there's a link between, the studies have shown a link between being obese or overweight and with regards to having reflux, but also smoking. And I'll talk in detail about it later when we go on to it. But essentially, there are certain triggers in our diet or our lifestyle that actually help either produce more acid or or reduce the tone of that sphincter, so you can then go on to have issues. Now, one of the things I think you wanted me to mention was about H. pylori. Now, this is quite a common infection, actually. Not everyone that has H. pylori goes on to have symptoms, but we find that the vast majority of people that do have symptoms may actually have underlying H. pylori, especially from those of the South Asian So India and Pakistan, I mean, there's statistics that have shown anywhere between 63 to 81% of these people actually harbor this bacteria. So we may find that certain areas of the country, especially where I've worked, we have a higher incidence of having H. pylori infection, but just because of the population, it seems to be more prevalent within them. Now, I think, I don't want to go on too much, but there are some very rare cases where they are genetic, and unfortunately, these people have really severe diseases, especially ulcers. I won't go into them in too much detail because I think it's beyond the scope of this, and it might just confuse people.
Okay, so clearly you mentioned factors from within our हमारे जो मैदे के हवाले से भी आपने जिस्म के अंदर से देखा कि किन वजूहात की बुनियाद पर जो है वो स्टमक अल्सर होती है, स्फिंक्टर्स के हवाले से जो कुदरती मैकेनिज्म होते हैं उनके फेलियर के हवाले से, फिर आपने जो है वो बॉडी वेट के हवाले से किया, फिर खाने के हवाले से किया, फैटी फूड, फ्राइड फूड वगैरह इस तरह से. There is a question from Razak Gumran. Is it true that yogurt helps with easing heartburn?
Sorry, say again. Is it true that yogurt helps with easing heart? Okay, so this is
milk sometimes is used.
Yeah. So this is actually a very interesting one. So the acid in our stomach is we look at it in something called the pH, which is the potential or power of hydrogen. Okay, and normally it's between about 1.5 to 3.5. Now, it's in a way a sort of a misconception that that milk is alkaline. So in order to buffer the acid, you need something that's alkali. And also the misconception that yogurt is alkaline. And if you look at it, pasteurized milk actually has a pH which is slightly acidic between, I think they say between 6.7 and 7.9. I'm sorry, 6.7 and 6.9. And anything below 7 is neutral. So this is the normal bit. Anything below that is actually acidic, and anything above that is alkali. So when you've got acid, you want something ideally above 7 to buffer it up. But obviously, when we take things like milk, yes, and yogurt. Actually, yogurt's even worse because I think yogurt has a pH of about 4 and plus, so 4 to 4.5. So what we find is, if you look at it in relative terms, so the acid in the stomach is 1.5, and if you have something above 1.5, it may have some calming effect because pH is logarithmic. So you sort of get a pH 2. If you mix two acids, that's a bit of chemistry, so I don't want to confuse things. But if you mix two acids together, you get an acid that's in between the strength of the two, but it's not an exact science where it's halfway in the middle. It can be only slightly better, but in some ways, if you take milk, for example, because it's better acid than the stomach acid, you might find that helps with neutralizing the area. And I think the other confusion is milk of magnesia, which we used to have. I remember we used to have it at home. That's actually not milk, it's just a white powder, but it's magnesium hydroxide, which is an antacid, and we'll talk about this later in terms of the treatment. So yes, milk does have some element of benefit, and we see that because people still keep doing it, although it's not the exact science where milk is the treatment for heartburn.
Okay, well ये चलो ठीक है, थोड़ा बहुत तो इफेक्ट होता ही है. अच्छा, ये डॉक्टर आदिल ने जो एक केमिस्ट्री बेसिस पर किया, तो इसमें इसका लुबे लुबाब खुलासा उर्दू में यही है कि देखें, थोड़ा बहुत तो फायदा हो सकता है, लेकिन ये इसका इलाज नहीं है. वैसे कॉमनली जो है वो थोड़ा दूध पियो तो बाज़ दफा साइकोलॉजिकल इफेक्ट भी होता है नफ्सियाती तौर पर, तो आधी बीमारी जो है वो बस उसी वजह से जो है वो चली जाती है. तो बहरहाल ये है कि ये प्रॉपर इलाज नहीं है इसका. लेट्स टॉक अबाउट नेक्स्ट स्टेप व्हिच इज the prevention point of view. Just before the prevention, smoking. Does smoking play a role in heartburn? That's one of the external factors.
Yes, so definitely. So nicotine, which is usually what main constituent of the sort of psychoactive part of the smoking tobacco, actually has two properties. One thing it can do is actually increase the stomach's production of acid. So now anything that you put into your mouth, your body gets ready to digest some food. And as a result, even if you're chewing gum, for example, your body thinks, food is now going to pass through the food pipe and I need to stay ready to digest it. But with things like smoking or chewing gum, these things don't actually go down. So all you do is you spit them out or you breathe them out, and the stomach acid then has to do something, and it's got to pass through. Either it digests more of the stomach, or it'll pass through to the small bowel and then cause problems in the small bowel because there's nothing else to buffer. Because food in itself acts as a buffer as well, to sort of like a sponge. if there's spillage somewhere, you put a sponge on it, you'll absorb it. It'll mean that the spillage is more contained. The other thing to recognize is that nicotine also, the band that we talked about, which is the anti-reflux barrier, that sphincter, that band is weakened. In some ways, it's made to relax because of nicotine. So as a result, when you smoke, you relax it, and actually that can have the negative consequence, which is that you get the reflux again.
Okay, there's one question by Asif Bhai. I would like to thank everyone who's watching us and everyone who's sending their comments. May not be able to take everyone's name, but Asif Bhai is asking a question that generally some adults develop bad breath, especially in the morning when they wake up. During the day, it is fine. What can be possible cause? What is advice? Is this something to do with our stomach, or is it something to do with our dental hygiene?
So it's you can't actually say it's not a one size fits all. So the bad breath, the halitosis, is actually a symptom of something else. Now that symptom could be that it's part of your reflux, especially if you suffer with reflux or have because it'd be very unusual for you to not have coughing symptoms, for example, and just have bad breath and say it's to do with your reflux. Ideally, you'd expect some element of knowing that the acid has passed to that stage. I would probably say if you've got no reflux symptoms, then the first step would be to see your dentist, because the dental hygiene is very important. And actually, we see that dental decay due to the bacteria, which is normally in our mouth, but sometimes they get into the crooks and crannies of our teeth, and because the food products have been lodged in that area, they start to grow, and just like anything else, any food that's there will cause bacteria to grow, and bacteria can actually be very smelly. So that may be the area to sort of pursue. I mean, good dental hygiene, oral hygiene is something that is recommended anyway to alleviate other health problems. But I think if you're having that problem, I don't want to take Asif by name. I don't know. I can't see who he is. But if he or somebody he knows is having that issue, then the first step of all would be to definitely think about seeing your dentist. Make sure there isn't anything obvious in the sort of dental hygiene side of things, oral hygiene, and then see your doctor about it, because we may need to assess it in other ways.
Okay, we've got obviously a few minutes left, and I've got to cover two other topic areas. But before that, I have. Well, we got a very interesting question. I think due to shortage of time, I'll just give some comments. This Tazir Dawood is asking, is marijuana or cannabis good for health, Dr. Saab? It helps many individuals for many issues. Legalize the herb. Now, I specifically put this question on, don't, please not. It's under research topic. And I can tell you that this cannabis clearly can lead to multiple psychological, mental health problems and everything. We are way too early to recommend any medical usage. If there is any medical usage of cannabis, then that has to be prescribed by the doctor, and the doctor knows you the best. So I do not recommend any legalization of use of cannabis in terms of herbs or anything. My advice will be avoid it. It gets out of hand, use gets out of hand, and then you get lots of mental health problems. That's a topic for another day. Let's move on to the next thing. Before I actually look at or I ask you, Dr. Adin, to address the lifestyle changes or what we can do. But before that, very briefly, just tell us that if we do not treat heartburn, we do not get proper advice, there's an underlying ulcers, what severe complications or important complications we can actually get?
Okay, so one of the things that can happen is, so first of all, you rightly pointed out that you can develop ulcers. Now, ulcers can lead to bleeding from the gut. Now, as a result of that, what can happen is some people can become anemic, and then this can have knock-on consequences in terms of how the body can function. They don't get enough oxygen going around. They may start to get symptoms of angina where the heart struggles because there's not enough blood pumping around the body. Now, so that you can actually have this issue. Now, when you have this bleeding, you can see it in two ways. One is that when you vomit, so we mentioned that one of the symptoms can be vomiting. Sometimes it can get so bad and you vomit, you actually vomit either fresh blood or blood that's slightly altered. We call it coffee ground, but it's got a slightly changed appearance. And so both of these are abnormal. So most people, when they vomit, it'll either be the food that they've eaten, liquid, clear liquid, or sometimes yellowish, which is bile. But if it's got blood, or if it looks like a brownish color, then that usually means that they've had some sort of bleed, and that's quite serious. Okay. Now, the other thing to bear in mind is that if someone doesn't vomit and that blood works all its way through the other bit parts of your gut in your bowel, and then you go to the toilet, sometimes that toilet can look, rather than being brown, it will actually look black, like tar-like, and quite sticky residue as well. And that's another sign that someone has had a bleed. Okay, so these are very serious, because these people will go on to have other issues. And unfortunately, the anemia is one of the sort of early things that we can pick up. But if it goes very severe, you can actually go through the lining completely, and that can cause even more serious complications. Now, if we look at we have in our system in the NHS, we have in our GPs, we have something called red flags. Now, these red flags are the serious symptoms that need urgent investigation, and most of the time, what this entails is having a camera that looks down just to make sure that they haven't got a serious problem. And one of these, and basically, these are having difficulty in swallowing. So we mentioned before that, if you have some burning of the food, you can find it. The lining of your esophagus, food pipe, can be eroded, and that might make it difficult. But also, the food still goes down, and some people may actually struggle with food then going down, and that's very serious. You call it dysphagia, but that's very serious. And especially if it's particularly painful, that's also quite serious. The other thing to bear in mind is, if someone's had a history of heartburn, normally they sort of self-managing, and they've been to see someone and they have some treatment, which is fine. But if we start to get this later in life, as most things, when things happen later and you've never had the problem before, and the cutoff seems to be 55 or over, then that's a red flag. That means that there might be something else, and we need to think about cancers maybe causing the erosion rather than the stomach acid. And as a result, because the erosions happen, there's an exposed area, and the acid is just burning. The normal levels of acid are causing problems. So that's something to bear in mind. And these people who, if you're 55 and over, and you've had this problem, but you also you've lost weight, and you're suffering with reflux, or GERD or dyspepsia, heartburn, then definitely make sure you go and see your doctor or have a discussion with them, because it may be that you need to go on to have further tests. Now, just to touch on the smaller bit, which is some people who have this problem long term may actually start to cause changes in the lining of their food pipe. Now, the food pipe lining is responsive to whatever damage that occurs. So if we use the example of our heel, the skin on the heel is very thick because there's a lot of pressure on the heel. But the skin is, in a way, the cells aren't no different to the rest of the cells on your hand and everywhere else. They just change slightly. And the same thing happens in your food pipe. At the very bottom, when you're getting a lot of reflux, the body cells have to adapt, and they start to become thicker. In a nutshell, and that thickness causes a narrowing. So naturally, rather than it being able to open and close very easily, it's now thick and scar tissue-like, and we call that Barrett's esophagus, something that we also pick up when we do camera tests that look down at people.
Okay, that's very comprehensive in terms of the major complications. Let's move on to our lifestyle changes that we can actually do to help prevent or treat the heartburn.
Okay, so first and foremost, like I mentioned before, reducing your weight is something that's beneficial. So everyone knows about BMI, and and a BMI over 30, is sort of obese, and that's usually bad news when you've got heartburn. So getting it lower has shown to have some benefit. The other thing is to avoid the triggers. Now, these triggers we mentioned in terms of smoking, but also things like chocolate and coffee. Now, a lot of people that have these food products or drinks will notice that they get indigestion or heartburn afterwards, and that's because they contain something called methylxanthine, which is a chemical that actually relaxes the band that helps protect the stomach acid from going into your food pipe. So if you relax it, you will get acid reflux. Spicy foods just generally encourage more acid production, and you're gonna have you don't need, it's no brainer. Having peppers and things will just make things worse. Other foods, I won't go into too much detail, but like tomatoes and things can actually reduce the sphincter, which again causes heartburn. And the other thing we highlighted earlier was the fatty foods, and I also already explained that it delays the progression of the food passing from your stomach into your bowel, and then as a result, it just makes it more likely that you're going to suffer indigestion or get reflux. And then also, it's not, we spoke about it last week when we spoke about diabetes, but also reducing the fatty acids is better. Now, the other things to bear in mind is that you can do some general stuff, which is that if you do suffer with this problem, then have your bed tilted slightly higher. Now, one thing to bear in mind is this is different than having pillows behind your head, because if you increase the number of pillows, all you're doing is rather than being like this, you're doing this. So this part here, your stomach is being more compressed, you're increasing the pressure, and you're more likely to get reflux. So actually, you might make matters worse. Ideally, you want to raise the bed in such a way so that I'm trying to do this in its inverse, but you want your whole body to be in that sort of position. So like a ruler moving upwards, that's the position that you'd ideally like to be. Reducing the amount of stress and anxiety also can help with reducing the problems that you get. And there's a link between having stress, anxiety, and increasing the amount of indigestion because of acid production. Then one thing that a lot of people have is aches and pains. Now, when we get aches and pains, we take paracetamol, but also another common drug that we take is something called ibuprofen, which is a non-steroidal anti-inflammatory. And these ibuprofen and the groups in the other NSAIDs actually can work in a very different way in terms of how it affects you. It actually stops you producing the stomach lining, which is protective, and as a result, that you've got less lining, and you're more likely that the acid will then cause problems. That's basically a completely generalization of it, but in a nutshell, that's how they work. Now, the other thing to bear in mind is if we're looking at reducing the pressure, wear some looser clothing. So there's no point trying to get into the shirts and jeans that fit you before you got married, because most people put on a few pounds. So you're gonna just go a size up. Ideally, reduce your weight and hopefully fit back into them. But in the short term, try and use some clothing that's a bit looser. In the picture, there's various other things that are highlighted, but I mean, they all essentially are part and parcel of trying to reduce the amount of acid that's sitting there. No, also one of the things that's mentioned, which is very simple, is when you eat and when you have your evening meal, try and have it about 3 to 4 hours before you go to bed. That's giving your body enough time for the content of your stomach to pass through into your gut, so it's less likely that you'll get indigestion. Typically, most people will eat like 7 o'clock and then go to bed at 9 o'clock, and then as a result, they not surprisingly, they wake up in the middle of the night having heartburn.
Okay, Dr. Adil, very sadly, we come to end of our time. I've actually gone over a few minutes. Asif Bhai will be screaming at me afterwards. It is the Greed class, so I don't want to overstep too much. Once again, thank you very much for a great session. Just before we go, obviously, some of the images that we do use, they are from the web. We are not making any money out of these. And secondly, because it's a time-limited, obviously, session, so sometimes we may miss important information as well. But always for the viewers of our social media, please consult your own doctor. The aim of this session is to educate you so that you actually go and see the GP or seek the appropriate medical help and guidance. Our advice is never final. This is general advice. It cannot be implemented by everyone in every circumstances. You always have to consult your doctor before you actually take any advice. The only one Shari thing that I wish to mention on the picture, it said that minimize alcohol. Now, obviously, from Islamic point of view, alcohol is haram and forbidden completely. But because we take these images from the web, clearly they are designed from a medical point of view, and they're looking at the general public. But from an Islamic perspective, basically we do not the alcohol is not allowed to be consumed. Okay, that's end of the session today. I would like to appreciate the engagement of the viewers. Many of them, Dr. Adin has asked you to come back, and inshallah, Dr. Adin will be back again with us next Sunday. You can suggest a topic that you want us to discuss. Otherwise, we'll choose it for you. And again, we choose those topics that are, affecting majority of the people. We don't sort of like come up with random topics or rare ones. So alhamdulillah, many viewers are liking the way we are delivering this information. So alhamdulillah, Facebook page of Leicester Fezan Medina will keep on doing this inshallah after the month of Ramadan as well, and after lockdown. So stay safe, stay home. Don't forget to wash your hands. Sallu ala al-Habib sallallahu ta'ala ala Muhammad sallallahu ta'ala alayhi wa alihi wa sallam.